Hey guys. In the episode I filmed about depression, I mentioned that the COVID pandemic had made everyone forget about the opioid epidemic, which had been receiving so much attention for years because so many people were accidentally overdosing and dying. Well, a few weeks after I filmed that episode, I received the latest edition of Florida Trend magazine with the title, "Masked by COVID, Amid the Pandemic, the State's Opioid Epidemic Has Intensified." I was happy to see this because, while everyone seemed to forget about it, I still continue to see patients in the hospital and in my outpatient practice every single day who are struggling with an addiction to opioids. In the hospital is generally people who have accidentally overdosed on opioids and end up committed to my psych unit for a suspected suicide attempt. And in my outpatient practice, it's people trying to manage an addiction to opioids using medications. So, first, a quick point of clarity. What is the difference between an opioid and an opiate? Because you may have heard both terms used. Well, an opiate, like heroin and morphine, is anything that's derived from the poppy plant, while an opioid is something like oxycodone or fentanyl because it's synthetically made, but all of them bind to the same receptors in the body. In medicine, we base everything compared to morphine using morphine milligram equivalents, because some of these drugs are much stronger than others. So for instance, fentanyl is 50 to 100 times more potent than morphine. So while these medicines are used to treat pain, they also cause the body to relax and they suppress breathing, which is why if you overdose, you fall asleep and you stop breathing. Because you can get high and relaxed off these drugs, they're highly addicting for many people. Not everyone. Some people do have just unpleasant, intolerable GI side effects and nausea from these medicines. They have no reason to continue abusing them, but for other people, they become a big problem very quickly. So how did this happen? Well, it really can be attributed to the rise of prescription opioids, which has also changed the image of who we think of when considering an addiction to opioids. Heroin used to be something just for street junkies and musicians, but now it's blue-collar workers, white-collar workers, stay-at-home moms, and even your grandparents who are abusing opioids. Well, how did that happen? Well, we really can blame doctors and medical education. Somehow, in the 1990s and early 2000s, it made it into standard medical school curriculum that pain was to be taken so seriously that it was considered the fifth vital sign for a patient, right up there with blood pressure, pulse, respirations, and temperature, and that it should be treated aggressively to reduce it as fast as possible. This led to wide overprescribing of opiates. Doctors were prescribing high doses of 30-day supplies routinely, getting a lot of people addicted to these medications. So you have people who would never have otherwise been exposed to an opioid medication now being given a high dose for a 30-day supply for any minor ache and pain they may report. But now that we've recognized how addicting these medications and drugs are, state medical associations have tried to rein in the prescriptions with new regulations on prescribing for doctors. This is well-intentioned, but unfortunately has left many patients who are addicted without a prescription. So you can still go buy oxycodone on the street, but it's expensive and it'll run you about $1 per milligram. So if you're taking 50 to 100 milligrams a day, this quickly becomes an expensive, unaffordable habit. This is when people, including your grandparents, your teacher, your plumber, a nurse, whomever, to turn to heroin because it's much stronger and it's cheaper. So essentially you get more bang for your buck. So what are the negative aspects of having an addiction to opioids? Well, your money will quickly disappear. Your friends and family and employer will quickly get tired of you lying to them all the time, and you'll probably put yourself in some compromising situations with dealers. Also, you could accidentally overdose and kill yourself. Physically, you'll be constipated all the time, and you'll notice a substantial reduction in your testosterone levels, causing your testicles to shrink, your body mass index to increase, and your sex drive to plummet. This is because opioids directly block the hormone that your brain releases to tell your testicles to produce testosterone. So it's essentially a chemical castration. Also, if you've progressed to the level of using needles to shoot up heroin or fentanyl, and you end up sharing needles, then you're exposing yourself to things like HIV, hepatitis C, and a variety of other infections. There are a wide variety of treatment options, though, and which one will be right for you will depend on your prognosis, which is determined by how far your addiction has progressed. If you stopped just with using oral opioid medications or even just snorting heroin, you have a different prognosis than if you've gone all the way to shooting up heroin and fentanyl using needles. If you've gone that far, you'll probably need to enroll in a methadone clinic. Methadone is a long-acting opioid which can help to reduce cravings for other opioids 24 hours at a time. It's a commitment, though, because you do have to go to the clinic to get your dose every single day until you've sustained enough sobriety and earned their trust to earn take-home doses. Now, if you haven't gone that far and you stopped with the oral opioids, then Suboxone might be a good choice for you. It's also a long-acting opioid, but it doesn't create the same euphoric feeling that methadone can produce, and you can often get a 4-week prescription for it. Now, without going to the exact pharmacology of it, if you use Suboxone and then you try and use another opiate on top of it to get high, you'll actually just put yourself in immediate opioid withdrawal, which is highly unpleasant, so you have no reason to abuse it, which unfortunately you can do with methadone. You can use other opiates on top of it to get more high. Finally, naltrexone is a pure opioid blocker. You can take it daily, or you can get a monthly injection called Vivitrol of it. And this works by blocking the opioid receptors, so even if you tried to use heroin, you just couldn't get high. This works for many people, but the danger that you run into is that if you become desperate to get high, some people use so much heroin or oxycodone on top of it to try and overwhelm the naltrexone, which eventually they will do, and then once the naltrexone's gone, they suddenly have a lethal dose of an opioid in their system, and it can cause an overdose. Now, there's also options like Alcoholics Anonymous and Narcotics Anonymous and other types of group therapy where you can get a sponsor to help you through your journey of sobriety, and that can be really helpful as well. A problem some people do run into, though, is some of these programs do require that you not use any medications because they think that if you're using one of these medications, then you're not truly sober. Personally, I think this is ridiculous because these medicines help many people regain control of their lives. And the danger with not being on anything is that if you go a prolonged period of time with no opioids and then you relapse, usually people use the same dose that they used the last time they got high. But now what was once a dose that got you high is now a dose that can be lethal and kill you because your tolerance dropped. This is why it's so important to have Narcan available, which is a pure opioid blocker and can be used to immediately reverse an opioid overdose. It can be prescribed by any doctor and picked up at a pharmacy and just kept at your house to then be injected if there's an overdose. Unfortunately, if you're in an overdose, you're asleep and not breathing, so you do need someone else around to give you the injection. So to reiterate what I said earlier, this is still a serious problem in society that is not discriminating among social classes. It seems like everyone today has a personal connection with someone who died of an opioid overdose, myself included. When I was a psychiatry resident, I had a colleague who was also in a psychiatry residency accidentally kill himself with an opioid overdose. This was a guy with a medical degree, specializing in psychiatry, who had a newborn daughter, and he accidentally overdosed on opioids and died. I think we all have one of these stories these days. So if you or someone you know is struggling with an addiction to opioids, please access treatment before it's too late.